Strain of coronavirus that has already claimed the lives of dozens of people in China has made its way to Arizona. There are 5 confirmed cases in the U.S. right now, and one of those is in Maricopa County. Here's what we know so far. The person who is sick is part of the ASU community. State health officials have not said their gender nor if they are a student there, but we do know the person is out of the hospital with mild symptoms and has to isolate themselves for 14 days at home. The person does not live on campus, but health officials are still trying to determine if he or she had contact with any of the classrooms on the Tempe campus. Now, experts say those most at risk were exposed by someone currently infected or have recently traveled to Wuhan, the province in China, but may not show symptoms for 2 weeks. So how are investigators figuring out who might have been exposed? Here's ABC 15's Courtney Holmes with those details.
It's the next steps in the investigation into the first case of coronavirus in Arizona.
Where they've gone, who have they seen, who have they spent time with.
Finding others who may have unknowingly been exposed.
They'll be working to determine whether or not that person needs testing, if they've got symptoms, and they'll be following up with them to see.
Dr. Kara Christ with the Arizona Department of Health Services says investigators are able to narrow down those contacts because of enhanced health screenings implemented by the CDC. Chris says people traveling from this particular part of China are being routed to 5 airports in the U.S. LAX, Chicago O'Hare, Atlanta, JFK in New York, and San Francisco.
And those passengers are being screened for signs and symptoms, for a fever when they go through customs, and then they're given information like, look, we know you've come from a place where this is circulating. We need you to reach out to local public health and to your healthcare provider if you develop these specific symptoms.
That's what she says happened here. Once symptoms showed, the patient contacted a doctor and triggered the county's investigation.
They are currently isolated in their own home, and the county is following up with them on a daily basis.
They'll also be following up with those who were in contact with the patient for a 14-day incubation period.
And sometimes it takes us a couple of times to go back to the individual, and each time we might get more information, but then we change our investigation as we get additional information.
We know that those enhanced health screenings by the CDC at airports began on January 17th, so that would mean the patient likely arrived in the U.S. on that date or later. In the newsroom, Courtney Holmes, ABC 15, Arizona.
Now, because of the coronavirus, state health officials have activated their emergency operations center. They do have that hotline for the public and medical providers. That number is right there on your screen, 602-747-7099.
The University of Arizona has issued a health alert for the coronavirus. Its campus health center offering tips for travelers heading to or returning from China on its website. Now, anybody traveling should avoid animals, dead or living, as well as animal markets. The university also warning to avoid products from animals and washing hands regularly with soap for at least 20 seconds. If you feel sick, avoid contact with others unless you're seeking medical attention. For the fullest, go to the Health Arizona website, healtharizona.edu. Including the case out of ASU now, there are 5 confirmed cases of the Wuhan coronavirus in the U.S. Johns Hopkins University has put together this map, and so far there are more than 2,800 cases around the world, with the majority of them still in China. It's a